All right. Well, so we're respectful of everyone's time. We will go ahead and get started. For those of you that are just joining, my name is Jessica Jones, and I am with the Mountain Plains Rural Opioid Technical Assistance Center. I am joined by Margie Deanda, who is our administrative assistant. So if you're on our mailing list, you'll be seeing her name as well. We are going to be hosting the Utah State University Extension's P.E.A.C.E program today, and they are going to provide a wonderful presentation and allow some opportunity for question and answer as well on this innovative program. So without further ado, I am going to go ahead and kick it over to Maren Voss.
Wonderful. Thank you. I'm excited to be joining you all today. Thank you for coming and discussing with me this important topic of the problem of pain. So I want to tell you a little bit about where I'm coming from. I am with Utah State University in Extension. And so if you're not familiar with the land grant university model, Extension offices are out in all of the counties, and the purpose is to bring the knowledge of the university down out into our communities so that we're not just keeping the information, sort of cloistered away at the ivory tower, but we're bringing it out to help the communities. And so we do that in our extension offices. And when I was hired, we were asked to address the opioid epidemic. And one of the things I kept hearing was that people needed alternatives to opioids if they were going to be able to manage their pain effectively. And that's how I got into working in this space. And I'll tell you a little bit more about some of the programs we tried to bring to our community and the type of successes and barriers that we experienced there. But before we jump into that, I just want to talk real quickly about the problem of pain that we're experiencing in our community. And so there's this word cloud that when we ask people, what do you think of when you first hear the word pain? And so people mentioned all of these things, and you'll see that a lot of the diagnoses people are having with pain get thrown up there, the migraines and the back problems, and whether it's surgery or neuropathic pain, those show up. But you'll also see some of the ways the pain is impacting their life, the loss of productivity, the depression, the stress, the quality of life issues. And so pain is a bigger issue than just a single diagnosis because it has such a broad impact on people's lives. And, I actually was presenting with someone else, and we found out that my 50 million number of adults in the US who experience pain daily might be a little low. He came up with a number of 60 million in some of his research. There are a lot of Americans experiencing pain on a day-to-day basis. And one of the things, I work in a rural community, and especially as you move out away from city centers where a lot of the treatment and clinical resources are, it can be really hard to treat pain. And so prescriptions are often relied on even more out in rural America. And so how do we manage this problem of pain? Well, we've learned a little bit in our society about the problem with opioid prescriptions that we're facing, and we've sort of demonized the pharmaceutical companies for contributing to that problem. But I do want to backtrack just a little bit to point out that the idea of helping people manage their pain was coming from advocacy groups as people were having cancer and other types of pain conditions, and they weren't always getting the help and support that they needed. So there was this outcry from advocacy group back in the 1990s. And around that, we had this idea emerge from some of the associations that talk about and think about the problem of pain, that maybe pain should be a fifth vital sign where doctors are checking in, what's your pain level in every appointment as just a part of assessing, are we managing your care and your healthcare well? So that idea of pain as a fifth vital sign really came from advocacy groups. And so doctors started thinking more about managing pain. Well, about that same time as opioids are one of the options for managing pain, there was this comment in the New England Journal of Medicine that was published where they did a pretty good analysis of almost 40,000 patients who'd been in their hospital, and just less than 12,000 of those had been given an opioid narcotic prescription. And when they looked across all those cases, they only found 4 cases that they could identify where it had led to an addiction. Now, this was not a quality controlled study. They did not randomly assign patients to separate groups to determine the impact of opioids and narcotics on outcomes. So this was just a comment. You can see it's like a 12-line comment. But in the ensuing years, as people were talking about pain and how do we treat pain better, it got cited over 600 times as, look, we don't have to worry about opioids as being addictive. They're safe. So about that same time, that's when the pharmaceutical companies jumped on saying, okay, we can come up with some different and new formulations where we can treat pain a little bit better using these safe narcotic and opioid prescriptions. So that's kind of what brought us to where we ended up. And you can see in that red line there, how many more opioids get prescribed in the US compared to other nations. We just really jumped on board with opioids as a solution to our pain problem in the country. And the problem with that, of course, is not only the addiction and the overdose issues that stem from using opioids long-term, it's also that opioid pills do not actually reduce pain in the long term. They're best used for short-term conditions like for post-surgery, for treatment that you can do in less than a week. That's when they're most effective. And as you move into chronic pain, which is usually pain that lasts more than a month, then the opioid pills don't do as good of a job helping people manage their pain. Actually, if you track people's pain across the months, people taking opioids do not experience less pain than people without them. So when we get into the biological mechanisms of long-term chronic pain, opioids tend to not be the best solution. And yet they're very effective for short-term immediate pain. And so we have to figure out how to balance that. So in extension, we explored a few different ways to try to meet this community need for finding better solutions for managing pain. And so we do a lot of community-focused education in extension. We call these things fact sheets. That's one of the approaches we took. We also used an evidence-based self-management workshop that comes out of Stanford. Their chronic disease self-management programs. We use that approach. And then we used an approach that we're going to talk more about today on the pain support groups. But I want to show you why we got to stage number 3, because this might relate to your community and what you need to do to try to address the problem. So fact sheets are beautiful. We have these beautiful handouts. They have lots of evidence. I mean, if you look at the resources on the back sheet of these, you know, they're full of evidence-based resources. And people need this information. And you can talk about pain and managing pain in a few different ways. We had one specifically mindfulness for chronic pain management. We have some where we talk about nutrition. We have some where we talk about exercise and how that can help your pain. And then we get into some of the other sort of evidence-based alternative approaches as well. So these are great. They've had, you know, thousands of downloads, but there needs to be more than just a piece of paper, and people would benefit from something more intensive than just information on paper or online. So that's a good starting point. It's not where we want to end up though. Now, the other approach we were taking an extension to get this information into our communities were the Living Well with Chronic Pain workshops that were Stanford-based programs. But these programs are really intensive. They are great. We work with the clinical partners and they refer their clients who need this support to these workshop series. But people have to sign up and commit to 2.5 hours a week for 6 weeks. That's 15 hours of education. And then when you're putting these on, you have to have 2 trained facilitators to lead a workshop. And that training takes, you do one training for a week, and then you do a second training that's another 3 days. So 8 days total of facilitator time. You have to buy the manuals. I mean, they're just labor intensive, they're time intensive, they're expensive with the manuals, but they're awesome. So I highly recommend them. And if you don't have these in your community, please look into these. But we also in our rural community needed something where the barrier to entry wasn't quite so high. Something at a more simple basic level. And if you think about it, like what I'm going to talk about in a support group model for introducing the ideas of self-management of pain, that doesn't have to be something that's in place of these other clinical or community options. It can be an alongside. And so I'm going to talk with you about a model where we can do something in addition to these other options that we may have in our community. But it's going to share this idea of having a toolkit for managing your pain. So this is an idea that comes from the Stanford-based program, as well as their whole chronic disease self-management model, which is we can give you an entire compendium of options and learn about all of these tools that you can apply depending on your circumstance and what works for you, and what your life is like, and how busy you are. And so you can pick from a whole list of options and try things out and see what works. And that's the idea of self-management. So we created this P.E.A.C.E curriculum. It's pain support groups, and we call it the Pain Education Community Empathy class. And I'll just tell you where we're at in our pilot that we're going to invite you to join with us on. So in 2020 to 2021, we piloted the implementation with just over 200 community attendees. And I'll show you the outcomes from that initial pilot that are good. We progressed from that with some focus group feedback. We did a curriculum update, and that brings us right now to our 2023 curriculum launch. So we have a manual that we've updated that we'll share with people who are interested. And now we're talking now in this forum, as well as some other regional and national forums, to let people join us in this new launch of an updated curriculum. We're still considering it a pilot phase. But here's where we were after the first round of piloting in 2 communities. 82% of people told us they gained new skills. 48% said that it increased their confidence in their self-management of pain. And 70% could say that they had an improved outlook on life because of the class. Now, these are really impressive outcomes, especially when I'm going to show you how simple this program is. It's a really simple implementation that can be done in any community, a low bar to entry. And so all people need to do is show up, and they can start to see some of these benefits. And again, as I mentioned, you can use this alongside the other clinical and health department kind of sponsored classes that you may already have in your community. If you want to join along, and you can scan this QR code, I just have a little, I mean, you can just see what I have on screen, but I have a couple of summary pages that you could flip through along with me if you want to scan along there. So the idea is that we're doing these free community education classes. They're going to have the support group component. And one of the reasons we included the support group model, I'll just mention, is because when I taught Living Well with Chronic Pain, the Stanford-based program, at the end of those 6 weeks, the people in the room had really bonded, they'd really connected with each other. And as they talked to us about what worked for them in that workshop, the thing I heard the most often was that it was sharing resources with people in the room. It was getting a sense of support from people in the room, hearing about what worked for them and what should they try, and which doctors were helping, and what clinics they could go to. And that support group piece had been really powerful. And so we wanted to do something that we made sure to include that support group piece and to make it easy to implement in a community. So this model is peer-led. And if you're not familiar with that idea, a peer is just anyone with lived experience. And so this would be someone who's had their own experience with pain, and they provide non-clinical or strength-based support. Okay, so they don't have to be a clinical expert. They don't have to have gone to medical school. They don't have to have any degrees. And the reason they don't need degrees is because they're experientially credentialed. So their own life experience is their expertise. And so they're not going to do anything that creates harm because they're not doing any clinical intervention. So they're just there as sort of a guide to walk alongside you on your journey. And so this implementation doesn't require specialized training is the point. And so also the people who will probably lead these sessions are people who are a little bit passionate about helping people manage pain because they've been there themselves. And so they know how important it is. So you end up with really committed leaders facilitating the workshops. And then it reduces the bar to entry because we don't have to get people with specialized training to do this for us. So because this is peer-led, we have at the very first 2 pages of the manual a basic list of do's and don'ts, what to do before the session, what to do during the session, how to wrap up at the end of the session. And it's full of very simple things, which is like just read the script. So every session is scripted, and then that allows them to not have to be a knowledge expert on their own. They can just read the script. We invite them to paraphrase and to put things into their own words, but all the information and content is there for them. They just walk right through. So before the session, just read the script. Prepare the handout. Every session has a handout that people can take home and bring some extra information home with them. So prepare the handouts ahead of time. And then they all also have an experiential exercise. Most of these don't require any equipment, but one of them, it's like some simple chair yoga. And so you might think about, do I have space in the room? That kind of thing as you're thinking about how do I prepare for the experiential activity. And then there's a few guides for during the session. And largely we're asking the peers to just be a group member. Don't set yourself up as the expert, but you are the person who's going to start and end the session, encourage people to participate. But alongside that, just be a group member in the session. And as you look at this list of don'ts, it's again that same idea of you're just a peer helping facilitate this. So don't answer every question. Don't try to be the center of attention. Don't sit at the head of the table. Keep this on a peer-to-peer level. We don't want anyone thinking we're giving them medical knowledge. So always defer to the experts and keep yourself in that role of a peer as you lead and facilitate these sessions. That would even apply, like, say it's a nurse who in a clinic is facilitating it. The idea is when she's facilitating the session, she's taking off her nurse hat and she's stepping into the room just as a peer with the people who are there and have experienced pain. All right, so starts off with some do's and don'ts. And then this is just a quick window into what one of the scripts looks like. So you can see the beginning, it's like, here's the materials you need. This is what you want to have with you. And then we invite you at the start of the session to do a welcome and an introduction. So you welcome the group, you introduce yourself, any housekeeping items, where the bathrooms are, that kind of thing. You give people their handouts. That simple, right? And then you're going to go into the next section, which is to introduce the topic, okay? And this is the script. Today, we're going to be discussing cognitive techniques for pain. That's that one. I'm actually going to work through with you actually on the second script, which lesson 2 goes into how to communicate about pain. And before I do that, I'm going to mention that the whole reason this model works and that an idea that we teach in the first session is that there's the chronic pain symptom cycle. And I want you to look at the things on that cycle and how they all feed into each other. If you haven't slept well and your muscles are really tense the next day, that's going to limit your movement. And as you're starting to feel tense and tight, that also restricts our breathing. One of the best things is when you do some simple yoga stretches or something similar, is how much more relaxed you can feel across the shoulders, and then how much easier the breathing is, right? But if you haven't done that, if your breathing's restricted, that tight breathing actually creates the sympathetic arousal that is part of the anxiety response and the stress response. And once you're starting to get stressed, then those, there's difficult emotions and depression, and that can lead to more fatigue. And you can see how that feeds into pain, right? Well, if I can relax the muscles and I can reduce the tension, and then maybe I sleep better, then I have less pain. So you can interrupt the pain cycle at any one of these points because they all feed into each other. So one topic that I can approach is how to manage difficult emotions. And if I can think about and address that in my life, that's going to down the road filter into me experiencing less pain. Another thing I can address is fatigue, and I can use pacing and planning activities. That's another one of our topic sessions, is how to learn how to manage your activities in a day to reduce the amount of fatigue you have just by pacing yourself, not trying to do too much. And if I can manage my fatigue, then that's going to reduce my pain because I'm going to be feeling better, may have less depression or anxiety because I might sleep better. I can interrupt the cycle there as well. So I can interrupt this pain cycle at any one of these points. And the other idea we like to stress is that pain then is just another symptom, but also depression is just another symptom of your pain. So you don't have to feel guilty when you have those difficult emotions, because it's just one of the other symptoms of your pain condition. So with that kind of a background, we can interrupt our pain response at any of a number of points. One of those points would be in how I communicate. So if I can learn to communicate better, that can have a positive impact on my pain. So I'm going to walk you through just a little bit of what a session would look like. So this is how we would start. This would be on the person's handout. And this is how I would start the session. So I'm playing the role of a facilitator. I'm reading from a script in this manual. And this is all a person has to do in order to present this program to their community. So I would ask to my group, by a raise of hands, how many of you have been asked by a healthcare professional to rate your pain on a scale of 0 to 10? Okay. And then in italics, there's a little prompt that says, okay, let people raise their hands, and maybe let a couple people give a quick verbal response. Okay, now this is called the numerical rating scale system, and these pain scales exist to help doctors determine pain levels, but they don't really tell us anything about pain duration or pain type or the other aspects of your pain. So they can be useful in creating a treatment plan, or when a doctor wants to evaluate the outcomes or the impact of the treatment they're giving you. But the problem with this general scale is there aren't really any guidelines on how to interpret it. We don't know what a 2 means compared to a 6, or a 1 compared to a 9. And we don't even know if what your 2 is compared to my 6, because people experience pain in a different way, because pain is just too subjective, and it's influenced by too many factors, like your emotions and how well you slept that day and what was going on in your family life, right? So what you experience as a 5 on a scale may be what I'm experiencing as a 3. And so it doesn't really give doctors all the information they need. Now, this is one reason why learning to communicate about your pain is going to be so beneficial. Okay, I'm going to skip down. And we would give people this handout. And let's see, I think I have an example of the handout right here. Okay. So people suffering from chronic pain often find it difficult to express what they're feeling, both physically and emotionally. Both can be hard. So not only are they experiencing difficult emotions when they're talking to their doctor, you may also find that it's hard to talk to your family members or your friends. So good communication skills are really important to reducing the frustration in your life, and getting rid of some of the stress that's in your life. So I want you to look at some of the other ways to talk about pain. So I have 2 other categories. You have the visual rating scale there on the left, but look at that next category. This is a way to talk about your pain by its duration. So think for a minute, the last time you experienced pain, how would you describe it? Was it periodic? Was it continuous? Would you say it was steady and constant, or was it more transient, rhythmic? That's another way to think about pain, right? And that gives us not just how intense it is, but what is the duration like as you experience it? Now I want you to look into that next column where we have 3 rows of a whole bunch of adjectives. And I want you to go ahead and take a minute and find 1 or 2 new words to describe your pain that maybe you haven't used before. Everybody take just a minute to do that. Okay, then I would ask the group, does anyone see a new word on the list that you could use to describe your pain? And again, I would allow for a response or 2. And then the activity goes into I versus you messages, and we coach people through. You can see how the I messages can make you feel so much more defensive and can shut down conversation, whereas a you message keeps the conversation lines open, and we can move into problem solving mode together, problem solving the issue together rather than sort of fighting against each other. So that the script continues on through that kind of material. So that's just a quick window. Again, it's scripted, really easy for a person to lead a conversation in their community. I'll give you just one other. Yeah.
I'm sorry to interrupt. We do have a question in the chat.
Great.
This is from Don Nelson. I've heard that physical and emotional pain are experienced in the same place in the brain. If this is true, then it causes some blurring or confusion. How does one determine how much of their pain is emotional and how much is physical? Since the symptom is pain, do we treat the pain symptom or the cause?
So Dawn, I'm going to respond just like I'm one of these peer facilitators. She's like, you know what? I don't know all the research on that, but that really resonates for me. And that totally makes sense. And, we were just talking about on that symptom cycle, how, there's some of the emotional things going on in your life are feeding into the pain. And it might be exactly what you're saying. It might be because the emotional and the physical pain are hitting in the same place. So I don't know the specifics on that. Maybe you would want to check in with your doctor, but to me, that just really reinforces how we can help address our pain at any one of those points that we talked about on the symptom cycle, right? So I don't know if I need to decide if it's emotional based pain or physical based pain. I need to figure out how in this moment to get to a place where I'm in a better place. And so if I'm going to address my difficult emotions, I'm going to use some of those cognitive strategies we learned about last week, maybe to work on that so that I can get rid of some of those negative emotions. Or maybe I'm going to move into problem solving mode, which is one of our other strategies, and go talk to my friend or my neighbor about what was going on, so that if I'm emotionally in a better place, I know that's going to make my pain better. And then hopefully if I'm less fatigued from my pain, I'm in a better place to address the physical side of my pain condition too. So I don't know, I'm not the expert, but that's a really good point you make. And I think we should talk about that. Hopefully at our sharing section, I'd love to hear more of what your thoughts are on that. That's how I would address it as a facilitator. And then in terms of, I think you're exactly right. Because there's so much overlap in the way our brain processes pain, it's actually one of the reasons I think why opioids don't work for long-term pain very well, is because pain is so complicated in the brain. And so I think let's not pick which type of pain am I experiencing and which approach should I take. I'm like, let's try all of them, whatever you have the capacity and whatever you can do right now. Let's work on some of the emotional causes. Let's work on some of the physical causes. Let's do them both. And then see if we can get to a better place with our pain. Hopefully that addresses your question, Dawn. Thanks for bringing that up. One of the other topics is yoga and Tai Chi. So we have some movement-based approaches to managing pain. So the handout and the script goes through just some of the basic benefits of yoga. You guys all know that that's an evidence-based practice for managing pain. We want people to realize that there's a lot of options. So when we talk about movement-based therapies, we're not telling you have to go try yoga. So we in the same session talk about Tai Chi. You can see how it's very similar, has those flexibility and coordination and balance activities that you see in yoga as well. So Tai Chi is another option, which we talk about some of the benefits. And then the handout has some of these really simple kind of chair-based yoga stretches, just to sort of in the class give people a chance just to see how these things feel. And so let's just go ahead and try them. Why don't you just do the one for the shoulders? Let's just take our arm across our shoulder and just hold that stretch for a minute. And one of the beautiful things about yoga is it incorporates breath along with the stretching. So while you're holding your arm here, just see if you can take a nice little breath. And as you're exhaling, kind of relax into that stretch a little bit more and see if it feels any different. And we'll go and stretch to the other side because we want to be balanced while we're here, right? So stretch the other arm across. And just take a full breath. And while you're exhaling, see if you can let that stretch release just a little bit more. And then the second one down that list, I don't know if you guys can see the picture. It's tiny, I know. But we're going to interlace our fingers and just stretch them up over our head. And maybe you'll lean your hands back a little bit. Sorry, I'm out of my little Zoom window there. It might blur. All right, and we're gonna let the arms go down. All right, that is all we're gonna do, but you can see if I did 9 stretches, I already feel better just from that. I don't know about you, but like my breathing, my shoulder, like that is all it takes to feel better. It's so simple, right? So we talk about how doing these stretches helps. We do some very simple stretches with people in the room so that they can already be like, oh yeah, while I'm watching TV, I need to do a couple of stretches because I can see how much better I feel, right? And then at the end of every session is the sharing component. So we invite people to like, now this is your time. So you can talk about anything that you need to talk about. We ask you to be respectful of everyone else's time so everyone can get a chance to share. And if there's anything that we've talked about today, if you've tried yoga before or movement therapies, and there were some of the things we hit on today that have been helpful to you in the past, please talk to us about that. We'd love to hear from you what your experience has been. And then we open up for sharing. Okay. So that is the P.E.A.C.E program. It is a nice little welcome introduction. It's a community setting with peers. We start with a 15-minute script where we give them a new idea. We do a little 5 to 10 minute activity where we give them a chance to try it out just to see what it's like. And then we have 20 to 30 minutes of people talking from their own experience about whether this has been helpful for them or not. It's that simple. And so then implementation, we want to be just as simple. So we have an online form for people to fill out. And I'm just going to show you what's in this form because it shows you the requirements for becoming a P.E.A.C.E facilitator. Okay, so you wouldn't be able to fill out this form until you complete the requirements. But once you have, this is what we ask you to do: that you attend a minimum of 3 P.E.A.C.E sessions. We're offering them online right now so that people can attend from across the country. So we can show you what it looks like. It's really intended to be an in-person community implementation, but we don't have a problem with people offering it online to an online group either. We ask that you use the branded marketing and teaching elements, which largely are the handouts that we have. And so we want everyone to be able to get those handouts. We ask that you just maintain the integrity of the program, which just means you're going to stick to the script. That's all it means. And that you're not going to be the expert in the room telling people, and you're not going to be pitching, some other non-evidence-based program. So maintain the integrity just by sticking to the script, to the basic evidence-based avenues for pain management that we have in the script. Okay. We ask that people provide it at no cost. So they promise not to charge people for these sessions. And then we encourage them to give the post-session surveys. As I mentioned, this is a pilot, so we want to collect information on whether or not it's helping. And then we can improve the session and the curriculum from there. And then we ask that people will do an annual facilitator update. So if you want to keep teaching it after a year, you just check back in with us. We can give you any of the curriculum updates that we've developed over that period of time. So this is, you check these boxes. This is all you need to do to become a facilitator. So you can see how low the implementation barrier is, right? So once people have checked those boxes, we're going to send them a flash drive that's going to include this, a PDF of this manual. So I have a printed copy, but we'll just give you the PDF of it. There's going to be some PowerPoints in case you're doing online. The in-person sessions don't have to have any PowerPoint, but sometimes those visuals help just a little bit. So the ones we've prepped for the online materials will provide, along with the handouts. The participant survey, there's a paper version, as well as you can do the QR or online link that you can provide to people that way. And then there's some flyers, those marketing elements that we mentioned, to make it easy to share in your community. And that's it. That's what people will get after they register. So that's the whole program. Are there any, this is just an example of the flyer that we have for people to sign up for our classes. Do I have any questions at this point? Like I said, doesn't take very long to explain this program because it's so simple.
Erin, there is one question in the chat from Jen K. It says, sorry if I missed this, but are the facilitators only for those that are peer-led, or we can do it as well?
So you will count as a peer. So they actually do this in the Stanford. I don't know if you've been trained in the Stanford chronic disease self-management programs. They do the same thing for that model, where they don't want you to be an expert. So even if you're a nurse, you're a physical therapist, if you're teaching their program, you're leaving your degree outside the door, and in the classroom, you're a peer. And so we do the same thing with this model. And so you can be a nurse teaching it, you just don't ever talk from your nurse expert place, right? So that's why when Dawn asked that question, I'm like, well, let me just answer the way I would if I was a peer. Like, I'm not the medical expert in the room. You should check with your doctor. Here's how, I would manage that. And we just talk from our place of as a person and not as an expert. And yes, we invite you, like, if you've got a pain clinic and you think this little easy curriculum is, will help your clients, please go ahead and try it out. Let's pilot it in your clinic and see if it has a positive impact. And we'll happily share the data with you to let you know if it's having a positive impact, as well as we'd love any of the qualitative feedback that you might get from your clients who take it. We'd love to hear how to change, how to tweak it. We're just in the pilot phase and would love to make it even better and make it just easy for people across the country to know that there's a lot of things you can do to manage your pain.
And Tara asked if everyone will be able to see these slides or watch the recording again. And we can speak to the recording. We will certainly release this recording and send it to everyone that has registered.
Yeah. And then if you take 3 of our sessions with us and sign up as a facilitator, we will give you all of those branded elements, which include some PowerPoints for each session so that you have some of those to guide the different sessions as well.
That catches us up on the chat for now, Maren.
Great. I don't expect a lot of questions because it is so simple. You know, I already shared with you that little bit of data we got from our first 200 participants that took the sessions. But you know, the data is very comparable to what you see in the more rigorous Stanford-based programs, just not quite at the same, you know, level of change. But it's putting people in a positive direction. And here in Utah, we have a really good implementation of the Living Well with Chronic Pain classes. And what I like to do is to cross share so that when people finish their workshop series, they can get referred into these sessions. But when we have people sign up through our outreach in these sessions, I want to let them know, you know, you can get even more help by signing up for these Living Well with Chronic Pain classes. Let me tell you about that, right? And we can expand people's capacity by using both programs to help them out.
We did have one more question in the chat. Don Nelson asked, how does this fit with the integrated health movement for peer support to try and bridge the medical and mental health divides or be more holistic?
So one of the groups we reached out to in Utah were our peer support specialists. They often, because they lead groups and sessions, you know, sometimes they need curriculum and content. Sometimes they have enough, but we've let them know that this content is available for them to disseminate and to be the peers facilitating these sessions if they think it's helpful for the people they're working with. So I think it goes right alongside the peer movement and is an option for them. But obviously peers do so much more than just pain education and support. But I think part of the viability of it is because we've learned how effective peers are because of that movement. And now we're realizing that there's other health domains where we can use peers to make a difference. And so the peer movement is something I'm passionate about. It's part of why we shifted toward this model to try to get it to be easy to implement in our communities. We don't need experts to share this information with us. We can do it with peers.
There are no more questions in the chat right now.
Well, you can certainly email me. We'll follow up with that email address, and we're happy to share any other information, answer any questions about this program, and ask you to share it out broadly if you think it'll work for your communities.
Thank you so much, Maren. And everyone, Margie will be posting a survey link in the chat. It will take less than 5 minutes if you wouldn't mind providing us some feedback on the presentation today, and be on the lookout for a follow-up email from us with the recording and other materials. And we very much appreciate your participation today. And thank you so much, Maren, for providing this information to the group.
You bet. And I just want to put in a pitch for doing that survey. Working with P.E.A.C.E and our Road to P.E.A.C.E. How do I say that?
ROTAC
has been amazing. There is so much potential in working together through these collaboration opportunities to bring more opportunities to our community. So I highly encourage you to complete that survey so that we can give them the information they need to do even more of this type of collaboration across our region. So thank you.
Thank you so much, Maren. Lots of great kudos in the chat.
Good.
Well, I hope everyone has a wonderful rest of the day and a great weekend. Tomorrow's Friday. So enjoy your evening and weekend. And if you need anything, you can always reach out to us as well at mprotac@wiche.edu. Thank you so much.